The tsunami no one saw coming, chronic Lyme disease. Thank you for joining me for this Common Sense Lyme series where I discuss questions that come up in my practice and problems my patients have. I'm Dr. Cameron, so let's begin. I'm using tsunami here. In healthcare, tsunami describes an overwhelming challenges that strain medical systems. The pattern I'm seeing is that patients have brain fog, fatigue, pain, neuropathy, all kinds of diagnoses. It can happen across all ages. It's often dismissed as aging, stress, or anxiety. Sometimes they're being told they have another diagnosis like mixed connective tissue, migraines, and so forth. Why Lyme disease is missed? There are negative tests or frustrating tests where it's mixed. The symptoms overlap with many other conditions, so that it's often easy to call it another diagnosis. And there's often a lack of awareness of co-infections like Babesia and Bartonella. So what patients are saying in my practice? I was told it was all in my head. Nobody believed me. I can't rely on tests themselves. Also, there's no treatment that is one size fits all. Doxycycline is commonly prescribed, but that doesn't work for co-infections like Babesia. There are different strains of the spirochetes. And so I think clinical judgment has helped me. There's also no test to tell you when Lyme disease is over. So I still have to use clinical judgment when my patient is still sick. I've had occasions where I've used short-term therapy that's worked, and I've had to use longer-term or combination therapy. I find treatment for Babesia particularly helpful because the traditional treatments don't work for it. And I listen to the whole story. There may be some other issues involved during counseling, during discussions. They may have to modify their diet. They may have to pursue another illness or a comorbidity at the same time. The call to action is that we need to listen, test wisely, and treat early. And those who don't get treated in a timely fashion, we still have to listen, test accordingly, make sure there's no other illness. I find that if I have someone come back in 3 to 4 weeks, that helps to reassess the patient. It also helps to have a variety of specialists involved in complicated cases. So let's stop this Lyme tsunami before it gets out of hand, before it gets worse than it is now. Thank you for joining me for this Common Sense Lyme. Have a good day.